dentists are the highest prescribers of clindamycin, an antibiotic that can cause C. diff diarrhea and has resulted in the death of patients. Dental guidelines no longer recommend clindamycin for penicillin allergic patients, and that is my antibiotic stewardship tip for all dentists and their patients.
As we all know, many oral antibiotics are ultimately handled by the patient themselves or their caregivers. As a final touch point of healthcare, while dispensing, pharmacists can play a significant role to encourage the rational usage of antibiotics.
And I'd like to talk about hospital wastewater, which is a key source of antimicrobial resistance. In their day-to-day activities, hospitals discharge huge volumes of wastewater. And this can include everything from pharmaceuticals to contrast media, as well as antimicrobial resistant bacteria and viruses. Now, this waste is doing serious damage to the public health and the environment. And what we try to do is to treat it at source. Our on-site treatment plant removes all micropollutants to below a detectable limit. And we believe it's this kind of robust engineering that is necessary if we are to tackle the spread of AMR.
Antimicrobial resistance is a silent threat, not just to people, but also to animals, including our pets. So fighting antimicrobial resistance on that side can also help us to have a healthier future as humans.
Has really been daunting on us, with millions of deaths caused yearly by AMR. To mitigate this, I'm utilizing social media health influencers. I believe with the millions of people reached yearly by these influencers, we are one step closer to mitigating AMR.
In 2017, WHO ranked carbapenemase producing Enterobacteriaceae, ESBL, like E. coli and Klebsiella, and carbapenem-resistant Acinetobacter baumannii and Pseudomonas aeruginosa as highly critical pathogen in the hospital setting, followed by gram-positive Staph aureus, MRSA, and VRE. Thank you.
I am an environmental scientist, and my key finding is environmental pollution is not just only disturbing the natural bacterial community, it's also selecting for high antimicrobial resistance genes in the environment.
Go. Cicadas and dragonflies have tiny nanostructures on their surfaces of their wings that can kill bacteria. My project focuses on fabricating these structures on a variety of different surfaces to prevent infection.
Antimicrobial resistance poses a risk to global health security, including our mission of ending malaria. Varying degrees of resistance to frontline antimalarials have emerged in Southeast Asia and in Africa, threatening control efforts. MMV is honored to be part of the global network of organizations working to combat AMR by developing new medicines for malaria that target current and future resistance threats.
AMR is clearly one of the greatest threats to global health. I am committed to eliminating AMR because I do not accept that millions of innocent people need to die as a result of resistant bacteria. My mission is to save lives by informing, educating and connecting professionals around the globe, together with the AMR Insights Ambassador Network.